Hello, my name is Maren Dominic M. Velasco, and before we proceed to the next slide, let me first explain what is the importance of program and project planning. We all know that planning is a vital part of the program and project management process. A plan is basically the route map through the program or project from start to finish. It is important because it provides structure and foresight for the execution stage and helping to eliminate wasteful activities and patterns. Give two topics of a public health program with a successful project planning which we are using nowadays.
The tobacco control component of the lifestyle-related diseases prevention and control program primarily aims to reduce non-communicable disease caused by cigarette smoking. It implements the World Health Organization Empower measures which monitors tobacco use and policies, protects people from exposure to second-hand smoke, offers help to quit tobacco use, warns people of its dangers, enforces ban on tobacco advertising, and reduces the affordability of tobacco products. This program helps create an enabling environment to help current tobacco users quit, protect people from secondhand smoke, and prevent young people from taking up the habit.
Is a tobacco control program important? Yes, because it serves the following purposes. 1. Prevention of the dangerously growing number of Filipino tobacco smokers. According to the article of the Union 2022, in the Philippines, 17.3 million individuals, 28% of the population, smoke tobacco. Men, 48% smoke at a greater rate than women, 9%. In their household, 55% of adolescents ages from 13 to 15 and 40% of adults are subjected to secondhand smoking. As a result, tobacco kills around 87,600 Filipinos every year, 240 fatalities per day, with one-third of them being males in their prime productive years. Each year, the Philippines spends $858 million on tobacco-related illnesses. 2. Eradication of second-hand smoke, SHS, exposure. Exposure to second-hand smoke is much more dangerous than smoking itself. Second-hand smoke is a mixture of smoke from the smoke that comes from the end of the cigarette and the smoke expelled by smokers. Second-hand smoke includes about 7,000 compounds, many of which are harmful and perhaps 70 of which can increase the risk of cancer. Health effects of secondhand smoke. In adults, stroke, lung cancer, and heart disease. In infants and children, asthmatic children who are exposed to secondhand smoking have more frequent and extreme asthma problems. Infants who are subjected to secondhand smoke have a dramatically expanded danger of sudden infant death syndrome, or SIDS. Every year, over 1,000 infants die as a result of smoking during pregnancy. Multiple health problems like acute lower respiratory infections, coughing, wheezing, shortness of breath, ear infections, etc. 3. Preventing initiation among minors and adults. Based on the report of American Lung Association in 2020, it has been found that every year about 2,500 minors attempt their first cigarette, with over 400 of them becoming new, habitual daily smokers. People who began smoking at a young age are more likely to acquire a serious nicotine addiction than those who began later in life. Most teenagers who have smoked at least 100 cigarettes throughout their lives claim that they would like to quit but they can't control their addiction anymore. With today's generation that was raised with so much trauma and a toxic environment, minors chose to let smoking as the output of their experiences. Therefore, for this to stop, authorities and their guardians must start in the root of their problem. They should be able to guide their children and nurture them with enough care and be able to help them heal them from their traumatic experiences to encourage them to stop smoking.
Hi everyone, my name is Andre Tristan Ciasares and my topic for today's video is about why dengue control program is important affect the community. So dengue is the most important mosquito-borne disease in the Philippines, especially in metropolitan Manila, where communities are social and economical diverse, and city governments struggle to provide basic services such as continuously available piped water supply to residents. We examined responses to introducing water container management to control dengue vectors in two diverse communities. In Masagana City, Village, Agate Community, and Village B, Informal Settlers Community. The rollout of the intervention was carried out by the study team. Dengue Control Professionals and Local Health Workers, or for short is BHWS. A behavioral change framework was used to describe the community responses to the introduction of the new vector control intervention, household water container management. Although the desired outcome was not achieved during the study timeline, observation and process of behavior change underscore the importance of understanding the social nature of the urban communities, often overlooked structure when control program researchers introduce a new dengue control prevention. The number of severe dengue cases reported from Sentinel sites in the Philippines increased from 37,101 in 2006 to 118,868 in 2010 and 2011. The disease is reported throughout the year with dramatic rise following the onset of rains. Although once compared urban and semi-urban areas, dengue is now widespread in rural areas. Philippines archipelago, it has now become the most important vector disease in the country.
Dengue Prevention and Control Program has a primary goal of preventing further infection for dengue disease, how the disease was transmitted, its symptoms, and its hazardous effects in the human body. Its primary importance are as follows. Prevention measures to national, regional, local levels, which means that the services shall not be only limited to urban areas but also to rural areas, which are less prioritized. Number 2 is increasing the availability of quality dengue vaccines and control services. With proper training and healthcare management, the distribution of dengue vaccines and control management services can be well implemented. Number 3 is the compliance with the national and local policies. The healthcare services or public service must be legal and must be allowed by the government to serve and gratify the needs of its people. Number 4 is offering cost-effective services in dengue prevention services, which means that in offering healthcare services, healthcare should not be business based or in more on a business interest, but on the welfare of the people.
Compliance with the national and local policies in providing dengue prevention services. As of January to March 2019, Department of Health Epidemiology Bureau has reported over 40,614 dengue cases. It's double the higher rate compared to the 2018 rate of dengue cases with the same period of time. So the national and local policies are providing the guidelines and service to prevent this dengue disease. The DOH called to the public to implement and enhance the 4S strategy in their households. The 4S is search, self-protection, seek, and support. The first is search. Search for all the stagnant water that may be their breeding ground. You need to destroy the mosquito breeding sites. 2. Self-protection. For self-protection, wear long sleeve and wear long pants. Seek for early consultant if you are feeling the early symptoms of dengue. And lastly is support. This is for fogging or spraying the hotspot where the cases is increasing and increasing. The WHO said that there is no specific treatment for dengue, but early detection and access to medical care lowers the fatality rates below 1%. And prevention is the key to fight dengue. Thank you.
Why dengue prevention program is important? The program is necessary to every community and state. Of course, it can help to avoid dengue, mosquito bites. In this program, the agency can discuss how essential to learn the remedies whether at home or in the community by clearing stagnant water, use of insect repellent, and keeping the environment clean and neat.